Good evening and welcome to MBN TV News. My name is Naadede Gogo. We begin tonight with the major stories making headlines both locally and internationally. Moving on to the major headlines, stay with us.
Ghana pushes for urgent continental response to rising xenophobic attacks. In business, Ghana now 8th biggest economy in Africa. On international front, and hantavirus outbreak not the start of pandemic. WHO says 5 cases confirmed on a cruise ship.
You can watch us on all our social media platforms at MBN 360. We have the details of these stories and more. Now the news in detail. The government of Ghana is calling for swift and coordinated action across African Union member states to address the growing wave of xenophobic attacks targeting foreign nationals on the continent.
Authorities in Ghana have issued a strong appeal for collective continental intervention following renewed incidents of xenophobic violence in parts of Africa. Government says the attack not only threatens the safety of African citizens living outside their home countries, but also undermines the regional unity and economic integration efforts under frameworks such as the African Continental Free Trade Area. Officials are urging the African Union to take a firmer stance by strengthening policies that protect migrants and enforce accountability among member states. Ghana's position highlights the need for diplomacy, education, and stricter law enforcement to curb intolerance and promote peaceful coexistence among African nations. The call also reinforces the country's long-standing commitment to Pan-Africanism and the protection of human rights across the continent. Government says it will continue engaging its counterparts whilst pushing for lasting solutions to prevent further attacks and safeguard the dignity of all Africans regardless of where they live.
Health authorities and development partners are calling for the united national efforts to strengthen child immunization in Ghana, warning the gaps in vaccines coverage could result years of progress in preventing deadly childhood diseases.
Stakeholders in Ghana's health sector are urging government and communities and caregivers to rally behind the child immunization efforts to safeguard the future of the country's youngest population. According to the Ghana Health Service, vaccines remain one of the most effective tools in preventing life-threatening diseases such as measles, polio, and tuberculosis. However, recent challenges including misinformation, access barriers, and funding constraints have slowed progress in reaching every child. Global partners like UNICEF and the World Health Organization continue to support Ghana's expanded program on immunization, emphasizing that no child should be left behind. Health experts warn that declining immunization rates could increase the risk of outbreaks, putting vulnerable communities at a greater risk. They are therefore calling for renewed public education, improved healthcare delivery, and stronger political commitment to ensure vaccines reach every corner of the country. Parents and guardians are also being encouraged to adhere strictly to vaccination schedules and seek accurate information from trusted health professionals. As Ghana works towards universal health coverage, stakeholders says a collective national commitment to child immunization will be critical in protecting life and securing a healthier future for
Minister of State in charge of government communication, Felix Kwakye Ofosu, has warned that the growing spread of disinformation poses a serious national security risk, calling for urgent and coordinated action to combat fake news in Ghana.
Government is raising fresh concerns over the rising tide of misinformation and disinformation, describing it as a direct threat to Ghana's national stability and democratic integrity. Speaking on the issue, Felix Kwakye Ofosu stressed that the deliberate spread of false information, especially through social media, has the potential to inflame tension, mislead the public, and undermine trust trust in state institutions. He warned that in an era of rapid digital communication, fake news can travel faster than verified information, making it increasingly difficult to control narratives during critical national moments, including election and security incidents. The ministers called for a multi-stakeholder approach involving government agencies, media organizations, civil society, technology platforms to tackle the menace. He emphasized the need for stronger public education on media literacy as well as responsible journalism to counter spread of falsehood. Felix Kwakye Ofosu also urged citizens to verify information before sharing, noting that individuals play a crucial role in either amplifying or curbing disinformation. Security analysts have echoed these concerns, warning that unchecked fake news could be exploited to incite unrest, deepen political division, and weaken national cohesion. As Ghana navigates an increasingly digital information space, authorities says tackling disinformation must be treated as a national priority to safeguard peace, security, and democratic governance.
Meanwhile, Ghana's Parliamentary Select Committee on Health has issued a stern warning to medical professionals, urging those unable to meet the demands of their duties to step aside, following preliminary findings into the death of Charles Amisa.
The Parliamentary Select Committee on Health is taking a tough stance in the wake of investigations into the circumstances surrounding the death of Charles Amisa, a case that has sparked public concern over healthcare delivery standards. Members of the committee said the probe has revealed worrying lapses in patient